Get a lot of questions recently about tennis elbow. I'm the developer of the Handmaster Plus, which we sell to therapists and athletic trainers, occupational therapists, many other hand therapists, for example. And so we do get a lot of questions about how tennis elbow occurs and what it is. And I just want to briefly address some of this. It is actually fairly simple, but some of the things that we've discovered about tennis elbow might be new, probably new to all the lay people and even new to some of the therapists that we have watching this video. Tennis elbow very simply is a word that is for the condition of lateral epicondylitis. It sounds like a real complicated word, but anytime you see itis in any condition, that means inflammation. Okay, so itis just means inflammation. The lateral epicondyle is an area of your upper arm bone, of the humerus. The lateral epicondyle is on the outside. Lateral always means outside. And medial means inside. So you have two epicondyles which are just bumps that muscles and the tendons insert onto. So the lateral epicondyle is over here. And the lateral epicondyle is the origin for the muscles, the finger muscles that extend the fingers, and also the wrist muscles that extend the wrist. Okay, so we have to ask ourselves, when the lateral epicondyle gets inflamed, which is lateral epicondylitis, what causes that? A lot of times I think we hear tennis elbow, and we forget about the cause of it. We're so busy concentrating on the name of it. Okay, so just like any other inflammation is usually from one of two things: overuse or weakness. Okay, so with tennis elbow, what is the most misunderstood thing is that what do these finger muscles do? What do these finger extensor muscles do? And what do these wrist extensor muscles do? Tennis elbow happens a lot in anything where we're gripping something. And I've talked about this on other issues, but I want to go through it with people that are using it specifically for tennis elbow. Anytime I grip something, what we think about normally is that the muscles that close their hand are only working. But what I can tell you is what muscles that are working just as hard are these finger extensor muscles that originate from this lateral epicondyle. Okay? They're working just as hard to support whatever you're doing gripping, whether that could be sports, that could be music, that could be in the workplace, could be in crafts, could be anything. Okay? If these muscles weren't working, these finger extensor muscles, imagine the fingers would just go like this. When we tried to flex something, we couldn't do it. Most of the time when we feel fatigue in any activity where we're gripping for a long time, sports is really, really common, music is really, really common. The fatigue is coming from the fatigue of these finger extensor muscles and wrist extensor muscles, because they're the muscles that are generally not strengthened very much. Okay? So that's a really quick thing about tennis elbow, is that if we want to prevent tennis elbow, we have to make sure we strengthen the finger extensor muscles. The product that we developed to do that, I think most people are starting to know about it now, is called Handmaster Plus. I'll show you it right here. It's very simple. It goes onto the thumb and then onto the fingers. And what it allows us to do is train not only the finger flexing muscles, the muscles that close, but those finger extensor muscles. Okay, so every time I train those finger extensor muscles, I'm going to make them stronger, I'm going to bring better blood flow to that area, and I'm going to prevent this tennis elbow that we see so commonly. So all I do is I close against the ball, open and spread against the court, close against the ball, open and spread. Now instead of 3 or 4 different exercises, I do one continuous exercise, and I will tell you that now we're going to keep these finger muscles strong, we're going to keep good blood flow, so we're going to have a nice, healthy insert or origin for that muscle at the lateral epicondyle, and therefore we're going to have very little chance for lateral epicondylitis. The other problem we show people that use their hands a lot is to really isolate the finger extensor muscles and the wrist extensor muscles, is to do this exercise. Squeeze against the ball, keep the thumb on the ball, extend just the fingers like I'm doing right now, then extend the wrist backwards. So 3 steps. Squeeze for a count of 1, extend the fingers for a count of 2, extend the wrist for a count of 3. Squeeze, extend, extend, squeeze, extend, extend. You can see each time I do this exercise, not only am I strengthening the finger extensor muscles, I'm also strengthening the wrist extensor muscles, and now I'm going to strengthen all 5 muscles that originate at this lateral epicondyle. And I can tell you, if you do these 2 exercises, you squeeze and open, then the 3-step exercise, like so. Even if you use your hands a lot, you're going to have a very, very low chance of having any kind of tennis elbow or lateral epicondylitis. To get this product, you can go to doczac.com and you can buy it online, or you look at any one of our distributors and brand partners. And once you get it, it's very, very affordable, very mobile. You can carry it with you anywhere you go, and it's easy to do. There's no excuses to not do your exercises and prepare so that we prevent tennis elbow or lateral epicondylitis.